Box et Jagdish Joypal. Messieurs, bonjour.
Yanish, bonjour, bonjour à tous. Jagdish Joypal, bonjour.
Bonjour Nawaz, Yanish, bonjour auditeurs et Internet, bonjour également.
La reprise des travaux parlementaires ce mardi matin avec la traditionnelle Private Notice Question du leader de l'opposition adressée ce matin au ministre de la Santé, le docteur Kailesh Jagatpal. Xavier-Luc Duval peut cibler ce matin l'état d'hygiène et de salubrité dans les hôpitaux publics. Jagdish.
Hygiène, propreté et surtout la salubrité qui est nécessaire dans le secteur de la santé. Mohamed et Sanjouman, des députés de pour lui, pour montrer donc qu'il y a un aliment, consommation, produits périmés qui peut stocker d'un entrepôt dans l'hôpital Dr Ditou. Ça, c'est un aspect, c'est alimentation, mais le ministère de la Santé peut démentir, pas peut servir ça ban produit là pour servir comme un c'est-à-dire nourriture à ban malade. Deuxième aspect, il y a une autre question concernant ban médicaments qui expirés et qui trouvent dans l'entrepôt de Castel et de Plaine-Lausanne. Il y a une bouteille paracétamol, il paraît qui périmé et qui peut contaminer les autres médicaments. Et là, c'est le docteur Faradomir qui fait une photo, il fait une publier, et quelques jours après, les photos concernant la nourriture. Donc, c'est la sécurité des patients, la confiance qui est là dans l'hôpital, qui sans doute, Xavier Duval, peut attire l'attention. Et il concerne également l'argent public, procédures qui suivent, et surtout d'urgence pour acheter médicaments, et si ça va une condition-là respectée. Maintenant, un comité d'élite Nawaz, il est nommé par le Premier ministre, avec députés des deux côtés de la Chambre, c'est ça qu'ils avaient dû demander, les besoins enquêter un état de situation et faire une proposition, cette question spécifique. Donc, il y a un pouvoir convoque un témoin, un responsable institution, dans le cas précis, c'est l'hôpital, également un enquêteur qui peut enquête au cas où il y a l'enquête, écoute d'autres versions, et après, il complète ce rapport, le rapport de Select Committee, il déposé au speaker, il remet une copie au speaker de l'Assemblée nationale et une copie circulée parmi les membres du Parlement. Rapport déposé, donc, mais seulement il n'est pas habilité pour faire une recommandation, pour prendre une sanction, ou bien, c'est-à-dire faire une poursuite. Il n'est pas là pour guider la police à le faire, une poursuite, un procès, et surtout si il y a certaines questions. Alors, le rapport, c'est l'Assemblée nationale, sans doute, qui prend une mesure nécessaire. Finalement, beaucoup de rapports dans le cas, dans l'histoire des parlementaires à Maurice, qui marquent donc les événements. Finalement, en 1994, par exemple, un rapport Select Committee, présidé par le docteur Swale Kassenali, qui amène la démission du ministre de l'Énergie de l'époque, Mahen Uchana.
Voilà, donc la séance va débuter avec l'hymne national.
Announcements. Honourable members, I have an announcement to make. My attention has been drawn to an interview given by the Honourable Juman to l'Express on Sunday, 5th November 2023. In the said interview, Honourable Juman is reported to have stated that the Honourable Minister of Health and Wellness met 3 religious persons in the committee room of the National Assembly when the Assembly was sitting on Tuesday last, whilst members of the opposition or refused access to their officers for holding press conferences. Honorable members, the responsibility for the management of the buildings and the general administration of the Assembly Chamber is vested in the Speaker pursuant to the provisions of Standing Order 78. Honorable members are well aware that the two committee rooms of the National Assembly are meant exclusively for the holding of parliamentary committee meetings. Hence, requests for the use thereof for other purposes by members, both from the government and the opposition side, are not acceded to. I must point out that neither my office nor the office of the clerk was in presence of any request from the Honourable Minister of Health and Wellness for the use of any of the committee rooms of the National Assembly. Following the above press article, I caused an internal inquiry to be carried out. I have to report to the House that the internal inquiry has revealed that at no point in time did the Honourable Minister of Health and Wellness make use of any of the committee rooms of the National Assembly, of any of the committee rooms of the National Assembly on Tuesday last, which in any event remain closed at all times on sitting days. The inquiry has further revealed that in fact, the Honourable Minister of Health and Wellness made use of the conference room of the Ministry of Finance, Economic Planning and Development. Honourable members, I take the view that such a statement coming from a honourable member without confirming his averment shows an utter lack of seriousness. Order! Order! Honourable Juman, I'll take you to task if you continue. Honourable members, I take the view that such a statement coming from a honourable member without confirming his averments shows an utter lack of seriousness. Moreover, the said statement is misleading and is tantamount to a gratuitous accusation of the connivance between the Speaker and members of the government to the detriment of members of the opposition regarding access to committee rooms of the National Assembly. Honourable members, in view of the seriousness of the unfounded allegations against the chair, not worthy of a honourable member, I cannot allow the matter to go unchecked. I cannot allow the matter to go unchecked, silent. Failing which, I cannot allow the matter to go unchecked, and I am inviting the Honourable Juman to make amends and tender his unreserved apologies to the House, failing which, I will have no alternative than to order the honourable member out of the chamber.
Not even during sitting. Not even during the sitting.
Are you tendering apologies?
Mr. Speaker, thank you for giving me the
No,
opportunity.
I have given instruction.
He met the free.
Can you? I am on my feet.
The meeting.
I am on my feet. I am on my feet. I have given you instruction to tender apologies. If you don't tender apologies, you'll have to withdraw from the chamber. So I am ordering you, you're not tendering apologies, I'm ordering you to withdraw from the House. And if you insist to stay in the House, I'll have to name you. You have already been ordered out. If you continue, I'll name you instantly.
But you don't hear others insulting him. You don't hear others insulting him. You don't hear others insulting him.
So let's continue.
Papers have been laid. Question.
Confirme réunion là.
Honorable Leader of the Opposition.
Now, my private notice question.
Order! Order, what is happening?
My private notice question
They have fire under their butt.
is addressed. Oh, I say.
Honorable, excuse me. Honorable Mohammed,
Yes.
you're trying to provoke the chair to ask you to withdraw from the chamber. You're coming to the chamber after long, so be careful.
I was hoping that
Respect the chair and the authority of the chair.
I'm asking the chair to see others insulting people in the opposition.
You don't have to instruct the chair.
No, I'm requesting.
And if you continue along that line, I'll ask you to withdraw right now.
You have to keep quiet then.
Keep quiet. You better keep quiet. Honorable Leader of the Opposition.
Honorable Mr. Speaker, I'm starting at 11:38. Please take note. To ask your doctor, the Honorable Minister of Health and Wellness, whether in regard to the state of hygiene and cleanliness in public hospitals, he will state if consideration will be given for the setting up of a select committee of the House to report on the current state thereof and propose remedial actions therefore.
Mr. Speaker, sir, in regard to the current state of hygiene and cleanliness in public hospitals, there has been no complaints. Since 1 week, the hospital services, in particular warehousing of food items, have been brought in the limelight by some honorable members of the opposition who intentionally, deliberately, and without authorization gained premeditated access to restricted areas of Dr. A.G. Jitu Hospital. Mr. Speaker, sir, on 30th October 2023, one member of the opposition trespassed into a restricted area and acceded to the general store of Dr. Jitu Hospital and used a mobile phone to make a video of the stored commodities therein with live comments, allegations, and posted same on social media. He was later joined by another member of the opposition who in turn made another live video making several allegations as well, wherein he informed that he has received several complaints from patients about the quality of food being served in Jitu Hospital. To dissipate any doubts in the interest of the public, the regional health director on the same day held a press conference. He stated that no official complaint about the quality of food served to patients or staffs who are entitled the same has been officially reported. The senior catering officer and the manager procurement and supply officer also reported that all food prepared are subjected to stringent hygienic condition and control. Mr. Speaker, sir, it is clear that these honorable members are deliberately inducing the public in error by making false and malicious allegations, sapping the confidence and trust of the public purely for political mileage and gains. They also live streamed in their video images of expired food items in one of stores that are illegally accessed out of the 7 existing. It's true that there were some expired items temporarily kept in the said store awaiting proper disposal as per established procedures and protocols. Mr. Speaker, sir, allow me to inform the House about the disgusting roasted tomato cans of 2.5 kilograms capacity which have been focused upon in the video clip. Unfortunately, I don't have the right to show the photograph of these clips. These cans were empty, roasted, and purposely. Yes,
Please
Mr.
reply.
Speaker.
It is entirely different question. I will show
Let me
you.
rule on this point of order. Quiet. I am on my feet. I am on my feet. No voice to be heard. I am on my feet. I am ruling on this point of order. You put a question. The minister forming part of the executive, answerable, accountable to the legislative, is replying. And the question, the reply has been prepared by his officers and himself maybe. So we should, in a parliamentary democracy, allow the minister to reply. Quiet, reply.
Yes, Mr. Speaker, sir, to point out, in his question, it is in regard to current.
Now, I am warning you for the last time. You are disrupting the procedure of the House. Continue.
Sir, this reply is in regard to the current state of hygiene and cleanliness. I have to point out what been said. So, what has been said, allow me, Mr. Speaker, to inform the House about the disgusting roasted tomato cans of 2.5 kilograms capacity that have been focused upon in the video clip. These cans were empty, roasted, and purposefully turned upside down to create the impression of that they were full and be used eventually for patients' consumption. Mr. Speaker, sir, just imagine how vile and malicious the intentions of those protagonists are. I will continue. Let me inform the House that these cans of 2.5 kilograms capacity each have never been procured by neither the G2 hospital nor in the health institution of my ministry. My ministry always procure cans of 425 grams, the small one, never the 2.5 kilograms capacity. Now the question is, Mr. Speaker, sir, how come these empty and rusted cans have landed in the store of G2 hospital? What is most suspicious is these empty cans and used up cans were pictured upside down. You know, they are so good at making videos to project and simulate that these cans were full and available for use. I'll stop like I won't say more than that. Now, Mr. Speaker, sir, regarding le chouchou, lamont, I don't know whether Kotomili were there. These pictures do not correspond to the vegetables item in our hospital. It's important to give this information. My officers have already made a statement to the police on the matter and the inquiry is on. Mr. Speaker, sir, my ministry operates 5 regional hospitals, 6 specialized hospitals, 2 district hospitals, 2 community hospitals, 7 medical clinics, 19 area health centers, and 113 community health centers, as well as 13 health officers. Ministry caters for more than 70% of the healthcare needs of the population. For the period of 2022, there were around 8.9 million attendances, 166,000 more admissions, and more than 49,000 surgeries on a daily basis. Around 2,600 patients stay in public hospital. Thus, over 10,000 meals are prepared, both for patients and staff, providing 24 hours and 3 times per day, including breakfast, lunch, dinner, and in-between tea breaks. Furthermore, I would like to wish to highlight that in 2022, some 929,000 patients' days were recorded in hospital, which means that nearly 3 million meals were prepared for patients for a year. Additionally, in respect to hygiene and cleanliness, linen services were provided for those patients together with washroom, bathroom facilities. I hope these honorable members one day will go, because they are expert in doing video clips, will go in toilets and also make some live comments. Mr. Speaker, sir, the internal cleaning of hospital is carried out by senior attendants supervised by ward managers and head of sections. Each at the health centers, cleanliness is carried out by handy workers, general workers, posted thereat, supervised by charge nurses. The maintenance team, posted at regional hospital, responsible for overall minor repairs and maintenance of hospital infrastructure. They are also responsible for general upgrading of works. Rare are the countries which are able to offer free healthcare services at point of delivery, including transport, medication, consultation, investigation, and treatment. Mr. Speaker, sir, in our current state of hygiene and cleanliness are being challenged, if our current state of hygiene and cleanliness are being challenged, surely this would have been impacted on our key health indicators, such as improved life expectancy at birth, decrease in infant mortality rate, increase in bed occupancy. Mr. Speaker, sir, however, my ministry does receive complaints through different channels, namely complaint desk at the level of hospital, citizen support portal, and on a daily basis on private radios and social media. And these complaints are attended to promptly. I'm tabling the list of complaints for the year 2022 for the hospital services, which can be categorized into different treatment, human resources, drug, and infrastructure. In regard to bugs in public hospital, in the past, complaints were received from our hospital regarding our staff, regarding probable infestation of bed bugs in wards. As per well-established protocol, Vector Biology and Control Division of Ministry is immediately informed to conduct entomological survey to assess presence of species and density of bed bugs. In parallel, Public Health and Food Safety Inspectorate conducts environmental health survey to check on the extent of infestation, harborages, and further course of action which entails spraying with residual insecticide are immediately taken. Furthermore, infested mattresses, beddings are immediately disposed or followed by treatment of the infected area. 10 days later, after 10 days, the entomological department carries another survey to check on efficacy of treatment applied. Mr. Speaker, I have to inform the House that my ministry leaves no stone unturned to ensure safe environment for patients admitted as well as staff involved. The rodent control unit of my ministry carries regular inspection and site visit at all hospitals and health institutions. The frequency of visits varies from daily to thrice weekly, depending on requirements of hospital and health institution. As regards the storage of pharmaceutical products, same are stored in ambient temperature, except drugs such as vaccine, insulin, and ampules, which are stored in temperature ranging 2 to 8 degrees centigrade. With regard to monitoring of cleanliness and sanitation, from January 2023 up to date, a total of 232 visits have been carried out in all hospitals, wards, yards, surroundings, and other units, and 34 statements of nuisances have been issued by the Public Health and Food Safety Inspectorate to ensure remedial actions are taken. Furthermore, 159 inspections have been carried out in various catering units in our hospital, which led to seizure of more than 350 kilograms of foodstuff. 138 samples were taken for microbiological analysis. All were found to be within prescribed microbiological standards. Mr. Speaker, sir, moreover, infection prevention and control unit is another crucial set of practices aimed at preventing the spread of infectious diseases with communities, healthcare facilities, and various public settings. Ministry has strived to reduce hospital-acquired infection by implementing the National Action Plan on IPC. Moreover, training was provided to more than 8,000 staff on infection prevention and control. Improvements in IPC scores have been noted. Mr. Speaker, sir, if health services delivered in our hospital are so full as depicted by some of the other side of the House, then how do we explain these? The management of COVID-19 in Mauritius has been commended by international front. Yes, by the WHO and the IMF. In 2021, Ministry obtained the Gold Award in Public Service Excellence Award for managing COVID-19 pandemic. In 2022, Ministry obtained the Gold Award in promoting an agile and responsive public service. The Coronary Care Unit of G2 Hospital has been awarded, winning the NPCC 2019 award, African Kaizen Special Award in 2021, Gold Award of the Public Service Excellence in 2022. Director General of WHO also congratulated Mauritius for the Presidential Award for the effective organizational change for the national COVID-19 vaccination program. In addition, Spine Unit of Victoria Hospital was also awarded the Silver Award of the Public Service Excellence in 2022. In a statement, the Director General said, Mauritius is a role model, not only for Africa and for small island development states, but also for the world. Mr. Speaker, sir, in light of what I have elaborated, I will leave it à qui de droit to decide whether a select committee is warranted. I would like to remind the leader of the opposition that such powers to institute a select committee is a prerogative of the Honorable Speaker. Mr. Speaker, sir, à qui profite le crime? Il est évident que l'opposition est en chute libre avec le verdict du Privy Council. Elle veut détourner l'attention de cette gifle magistrale qu'elle a reçue. En faisant de la démagogie, elle veut aussi détourner l'attention du public de ce qui s'est passé à la citadelle. Ce qui est dommage, c'est qu'une partie de la presse joue le jeu de l'opposition, mais la population n'est pas dupe. Ce qui est malheureux, Monsieur le Président, c'est qu'en agissant ainsi, l'opposition est en train de saper la confiance des Mauriciens dans les services hospitaliers alors que celle-ci fait partie intégrante du traitement. Je laisse à la population le soin de juger qui sert mieux son pays, les membres de l'opposition ou les 14 000 hommes et femmes qui travaillent dans la santé publique pour sauver des vies. Et pour terminer, je pense à tous les patients bénéficiaires de notre système de santé que je remercie pour leur confiance et pour lesquels tous les employés de mon ministère travaillent nuit et jour. Merci.
Mr. Speaker, I will turn the Minister and his reply upside down. I like to ask the Minister whether he is aware of
this one.
An internal audit
it is
report.
upside down.
An internal audit report. An internal audit report dated 11th July 2023. You are aware of that? Ah, good. And an exit meeting chaired by your Permanent Secretary, Mr. DC. In that report, Mr. Speaker, I'd like to ask the Minister whether he has read it and he has seen that the internal audit report looks at Dr. G2 Hospital and Brown Séquard mainly, talks of deplorable conditions in wards, huge wastage of food, chaotic situation, rotten foodstuffs, fresh food not being served to the public. Is he aware of that report? And why that report? That report was submitted.
Honorable Mohamed, I'm warning you. Order. I've already warned you twice.
It's not parliamentary.
Last time.
It's not parliamentary.
Last warning.
That report was dated 11th July, and the exit meeting by your Permanent Secretary, attended by some 30 other people, was in September 2023. Are you aware of that? And if so, why did you not disclose this to the House today?
Mr. Speaker, sir, I am fully aware of all audit reports. It is my duty to take all the audit reports and to improve on that. I'm sure, honorable member, he also knows what has been the reply of the ministry to the audit report. The auditor can make any reports, it is their right, but it's also the officer's right to give a reply to these audit reports. And I'm sure that the replies, we do agree that at times, yes, but not what you said. It's been as if the whole system, so all the patients have been provided with whatever. It's all, I totally agree. In fact, it's good that we've seen expired items, because if we don't use expired items, so it will be there, and you have to undertake procedures to get rid of them. It is, this is completely clear.
Your Permanent Secretary in that meeting took note that there was huge wastage of food because patients were not being consulted for the meals, which is contrary to practice. Are you aware of this?
Totally.
Huge
Mr.
wastage
Speaker,
of
sir.
food. He said yes. He said yes. He said yes.
Mr. Speaker, sir.
Let the minister reply.
Me reply
You
to
already
this
put a
part.
question. Let him reply.
Now I will reply to
You
this
keep
part.
quiet. You reply.
Mr. Speaker, sir.
Keep quiet.
This, the honorable leader of opposition is stating that food being wasted. Totally agreeable. Because the quantity of food is being prepared based on a formula. And it is obvious. Patients are kept fasting in ward. They don't take food. Patients being discharged before the time that, there always been the preparation being done in the morning, and patients being discharged at times even in the morning or afternoon, there would be wastage of food. There is no system, there is no formula that the exact quantity of food can be prepared, and that is totally agreeable that there would be. But what is more important, patients are being provided food, quality of food. Patients are being provided safe food. Patients are being provided food that has been freshly cooked. For the wastage, I totally agree with you, Leader of Opposition.
Continue, therefore, because you did not consult the patients. That's why you have huge wastage. Now, on paragraph 2.14, it says this. The committee was informed. Listen to this. The committee was informed that stale leftover food cooked 6 days prior were also found in the BHS. It was understood that fresh food was not being served to patients. Did you read that part also? So why are you...
Mr. Speaker, sir, totally that all the recommendations of the audit has been taken care of. See, 80% of all recommendations of internal control are being implemented. There are, at some places, as I said earlier in my reply, to have 10,000 food cooked on a daily basis for the staff, for the patient. Obviously, it is totally correct to say that the audit has to do its report and the ministry has to implement the recommendation of the audit. But this doesn't mean that, Mr. Speaker, sir, we take political mileage through all these officers who are working, from the store manager to the cook, to those who are in charge of the catering unit, and now to come and blame them for whatever they have been doing.
Mr. Speaker, it is your Mrs. officers which are giving us these reports because they discuss it with you. That is the truth. Mr. Speaker, I'll continue with the report. It says here, Mr. Speaker, according to surveys carried out, hygienic conditions of wards was deplorable. Now, this report was dated 11th July. The exit meeting by your PS was a few weeks ago in September. You already took more than 2 months to even consider the report, and nothing has been done since that time. Nothing.
Mr. Speaker, sir.
Are you aware?
Let
What
me
is that
reply.
fool talking about, question là-bas? Now,
Mr. Speaker, sir, let me reply this part.
Leader of the opposition,
Yes.
bear with me. I find the House a bit unruly today. I'm giving a warning, both sides of the House. We are doing serious business today. And Leader of the opposition, your question should be specific.
are you aware that your own ministry, this is not the report of the Director of Audit, this is your own ministry, says that your own wards, hygienic conditions was deplorable. That food served in the wards were cold. Section 2.9 of the report.
Mr. Speaker, sir, that's what the ministry has to do. whenever you have a report from the audit, the ministry doesn't work in the hospital, and the food is being prepared on a daily basis. The hygiene, it is on a daily basis, and wherever we have been pointed out that the hygiene is not proper, the food is not proper, my question is, has the ministry taken action or not? Obviously, the ministry is taking action. It's going to be as such, and we also, it's not only to wait for audit reports, our IPCs, the sanitary divisions, do take continuously monitoring whatever the hygiene and the sanitary conditions of the hospital, of the ward. This is an ongoing process, and we have to admit that we have to continue doing it. We have to be continuously doing all the improvement and the monitoring of these services. This is totally normal. And even if I will give you examples of what's happening in private clinics, but that has to be, it doesn't mean that we should blame private clinics or any other institution, but it's a question of hygiene, food items. It's a continuous process, and we have to continuously implement, whether it is recommendation from the hospital, and ministry has to act. Obviously, the ministry will take the time to act, but action is being taken. And we will keep on having, Mr. Speaker, sir, complaints, be it from wards, from toilets, if I don't know whether they're also expert in these, and then from all the different services, because it is being used by public, and how these services have been used. So it's not a question of blaming who and when. It's a question of how do we address these complaints and what the minister has engaged in how to address in these complaints.
Mr. Speaker, I'd like to ask the Honourable Minister whether he read the report in page IR report, Internal Audit Report, 8.2 section. It says on rotten vegetables, page 21, in the catering unit, vegetables were found rotten and not fresh. Rotten ladies' fingers, and margaux, aubergine, and cucumbers, all rotten. Onions had already sprouted. This is in your hospital 3 months ago. And the pictures that have been taken and put on the web by my colleagues, and rightly so, were a few days ago. That proves beyond doubt that you have done absolutely nothing after this report on G2 and brown secor took place.
Let the minister reply on
Yes,
this.
Mr. Speaker, sir. Vegetables are being delivered directly in the catering unit, in the kitchen, on a daily basis. The volume of vegetables being procured is as per the conditions of the contract. It would be obvious, even in your kitchen, Mr. Speaker, sir, in all our fridge, there are vegetables that has gone, it's already been start decomposing, something like that. Mr. Speaker, sir, and for that volume, and if these vegetables, before sending these vegetables to Moshikos, the officers, it will be, in fact, that should be, we have to be reassured, because these vegetables, if they are left there, even if you've taken pictures, it means that these vegetables have not been cooked. What you have been saying, these vegetables have been left over there. Obviously, it takes its time to get rid of these vegetables. In fact, that's a good thing that we've seen these vegetables, and you will keep on seeing these vegetables, because vegetables being procured on a daily basis, and there would be a percentage, a quantity that will be, start getting, will get rotten, and that will be disposed. In fact, I think it's a good thing, leader of the opposition has pointed out, that you can see those vegetables, because the catering unit, the officers will tell you that these vegetables, when they are rotten, it will be meant for disposal.
Page 24 of the report, 16.5 kilos of bread-songe. You're a bit like bread-songe yourself.
Maybe.
Prepared 6 days ago. This might imply, this might imply that fresh food.
Leader of the opposition. Yes? What is that word bread?
I withdraw it. Don't worry about it.
Leader of the opposition. Leader of the opposition.
What is it?
You have to apologize.
I apologize. No problem. Mr. Speaker, I'd like to ask the Minister, page 24. 16.5 kilos of bread change, prepared 6 days ago. And this is what your audit report says. This might imply that fresh food was not being supplied to patients because he found 16.5 kilos of bread change and 85 kilos of ladies' fingers which had been kept for 5 days and already rotten. So your own internal audit says that this would imply that fresh food was not being supplied to patients.
Let the Minister reply.
Mr. Speaker, sir. Vegetables are kept in cold rooms in our hospital, in our catering unit. I will ask myself, in my fridge, there are vegetables kept for 1 week that we do consume, and then my wife, after 1 week, do prepare these food with these vegetables. So if vegetables being kept properly in the storeroom and cooked after 5 days, if the catering unit, the in charge, would have tell you that these vegetables are rotten, it would have been left over there. And if after 5 days we do cook whatever vegetables you have mentioned, unless anybody in our house, they don't cook food vegetables after 5 days. I haven't seen anything like this as a sanitary protocol that fresh vegetables, whenever they are bought, kept properly in proper storeroom, storeroom, that should not be used for cooking after 5 days. If this report can be submitted to me, I'll be happy, and that we will put it in the Food Act, that everybody, whenever you purchase vegetable 5 days back from your market and so on, after 5 days we've got to discard it. So this is the reply to you.
It is his own report. I have no need to submit.
Time is over. Time is over. Time is over. Honorable members, the table has been advised that PQ will reply by the...
30 minutes pile, donc pas de fucky time comme on dit dans le jargon footballistique Jagdish. 30 minutes pile pour la PNQ. Alors un PNQ bien intéressant qui le leader de l'opposition fin évoqué ce matin.
L'intérêt public.
Alors et là-dedans, il y a deux aspects très importants. D'abord dans sa réplique, si nous analysons ça comme un match de football, donc dans sa réplique, le ministre Jagat fin isco un joli goal contre l'opposition quand il a révélé que sa canne de tomates que l'opposition t'a montré, c'est une canne de tomates 2,5 kg capacité. Il dit que sa canne de tomate là, il est vide et il est rouillé. Et il dit que jamais ministère de la Santé fin acheter canne de tomate 2,5 kg pour mettre dans le store dans l'hôpital. Il dit que le ministère a acheté une petite boîte de 425 grammes. C'est ça qu'ils ont servi. Et là, Khaled Jagatpal peut demander de quelle manière ça une canne de tomate de 2,5 kg fin atterrir dans le store l'hôpital. Et là, il peut dire que l'opposition peut faire démagogie, l'opposition peut manipuler l'opinion publique, peut induire le public en erreur, et sur un officier fin faire un statement à la police et n'a une enquête qui est en cours. Et Khaled Jagatpal peut dire qu'ils escalent pas aucune plainte officielle qui fin faire par rapport à la qualité de un repas qui est servi à un patient et un staff l'hôpital. Mais quand on arrive à la tranche d'une question supplémentaire, et c'est là que cette fois-ci, c'est Xavier Duval qui est un joli goal, si nous prenons toujours de l'aspect footballistique. Xavier Duval dit, il brandit le Internal Audit Report qui est préparé par le ministère de la Santé, donc ce propre ministère, et sa rapport d'audit interne là dit qu'il fait état de conditions déplorables dans la salle Et il dit qu'il y a manger, foodstuff qui ne finit gâté, périmé,
Il y a un gaspillage.
et Xavier Duval dit, d'après lui, qui ce rapport-là, dit que parfois, repas frais, fresh food, pas finit servi à patient. Et là, Xavier Duval cite différents points dans ce rapport-là. Alors, il dit, par exemple, qu'il finit trop légumes qui ne finit gâté. Et il dit, Xavier Duval dit que 3 mois de cela, parce que ce rapport-là date du 11 juillet, il dit qu'il y a un légume qui ne finit gâté, qui s'est trouvé le 11 juillet, et il dit que récemment, c'est un membre de l'opposition qui a tiré photo, encore il y a un légume gâté, et Xavier Duval, il peut conclure d'après lui qu'il n'a pas fini de faire rien. Et il aussi dit qu'il mentionne 16,5 kg de bretsons qu'il préparait 5 jours avant, et 80 kg lalo 5 jours avant. Et là, la réplique du ministre Diagatpal, il dit, mais nous-mêmes, la case, dans nos frigidaires, nous achetons les légumes et ça reste dans le frigidaire pendant 5 jours. Et lui, il peut dire que ça les légumes-là, être conservés dans une chambre froide, une cold rooms. Et il dit que, si arrivé qu'il n'y a pas d'ina et qu'il y a un légume qui gâté, mais il peut maintenir qu'il pas servi ces légumes-là pour préparer repas et servir ça à ben patient. L'idée qui ça ben légumes là, vous êtes disposé, vous êtes été, mais il y a une procédure et ça prend le temps. Alors, et lui-même dit qu'il coûte lui-même sur la case, donc il y a ces légumes, il garder 5 jours et après 5 jours sur madame cuit donné. Donc, voilà la réplique du ministre Diagatpal. Mais le leader de l'opposition, lui peut maintenir qui l'état déplorable et il cite le rapport, il dit qu'il peut servir un repas qui froid à ben patient d'après le rapport tel que mentionné par le leader de l'opposition. Alors là, Jagdish, donc, il y a d'une part l'opposition qui peut être accusée de démagogie avec l'affaire de canne tomate 2,5 kg, qu'il dit qu'il jamais ce ministère a acheté. Et il peut insinuer que c'est l'opposition lui-même qui prend une canne tomate vide, il amène ça dans un store, et je peux faire live, je peux montrer qu'il peut servir ça une canne de tomate qui est rouillée. Et d'autre part, Xavier Duval, il peut brandir le rapport de l'audit interne pour montrer qu'effectivement, il y a un problème d'hygiène, de salubrité, et il y a un problème de légumes gâtés qui peut être conservé. Mais le point du ministre Diagatpal, il peut dire, il n'est pas deny qui est capable de ça, mais il peut dire qu'il n'a pas servi ça un légume gâté là pour préparer un repas et pour servir ben patient et ben staff.
Voilà, donc d'abord au départ, le ministre de la Santé, une acquise l'opposition, politise une situation alors qui, d'après lui, pas existé, surtout concernant ben produits périmés, alimentation, et dans le premier cas surtout, ben produits alimentaires, il dit que l'opposition peut remontrer ben photo qui vraiment, d'après lui, il a inventé, c'est pas, il pas faire partie de ben stock de produits qui le ministère de la Santé veut servir, par exemple, tomates. Deuxième, il dit que ben, c'est un député qui a accès à ben l'endroit qui n'est pas autorisé, donc non autorisé, interdit, et je fin servi téléphone portable pour tirer photo et pour exposer et ben, produits qui vraiment, et là, il concédé qu'il y a certains produits qui périmés, c'est-à-dire dépassés, et pas capables de servir, mais il y a en stock en attendant qui ça ban produit là donc pour être dispose d'œuvre, c'est-à-dire éliminé et ensuite par rapport à ban responsable de la santé. Alors, et là, le ministre Diagatpal, il fait un état de situation, la responsabilité du service hospitalier pour servir surtout, pour répondre à l'appel à la situation qui est là dans l'hôpital. Et il dit qu'il y a environ 10 000 repas qui peut faire par jour dans l'hôpital et il y a 3 millions de repas par an destinés à ban patients et d'après lui, toute bonne disposition de sanitation peut prendre et pour qui au moins malade je gagne un service satisfaisant. Complainte, comme on dit dans Oise, il peut dire pénal complainte, mais à chaque fois il y a complainte, le ministère atteint tout, c'est-à-dire promptement, c'est-à-dire je te guetter, je te faire un suivi et je t'analyse la situation. Maintenant, là...
Mais là, un aspect, Jacques, qui est très important, une précision. Dans son réponse, le ministre Jacques Pal, avant qu'Isabelle Duval pose une question supplémentaire, il dit qu'il servait fresh food.
Oui.
Hein? Repas qui fait préparer, c'est ça qui servait à un patient. Oui. Mais Motan Isabelle Duval dit dans la tranche supplémentaire que les causes de fameux bretsonge, il dit bretsonge est préparé 6 jours avant. Nous pas cause bretsonge qui pas encore cuit là. Il peut dire 16.5 kg of bretsonge prepared 6 days ago. Mm-hmm. Et donc, là, maintenant, le ministre, il peut dire qu'il servait un repas frais. Et là, le ministre dit non, mais ça gardé dans un cold rooms. Là, il y a quelque chose qui n'est pas clocher là. Donc, nous avons une précision là. Est-ce que ça bretsonge qui est préparé, mais déjà une cuit. Une cuit 6 jours avant. Est-ce que ça finit de servir à un patient, même s'il garde ça dans le frigidaire ou bien dans un cold room. Donc ça, c'est un aspect très important parce que le ministre, il dit dans son réponse qu'il servit un repas qu'il fait préparer, c'est ça qui servit à un patient.
Ouais. Et le ministre de la Santé, Khaled Jakatpal, il reconnaît quand même, ça va une proposition qu'il fait dans le rapport de l'audit, internal audit, et du ministère de la Santé. Alors, ça existé, il y a un état de lieu qui ça existé, et donc, mais seulement, les dire, obviously, et évidemment, action peut prendre, il y a un monitoring, un suivi continu qui peut assurer, et donc, c'est un ongoing process. Alors, donc, c'est une continuité pour améliorer davantage le service et la situation. Donc, le responsable du ministère de la Santé, je vais agir, je suis capable de prendre les temps, mais seulement, malgré tout, je peux adresser à toute bonne complainte qui est là. Et Xavier Duval mentionne donc une situation qui reconnaît, mais là, quand le ministre peut capable gagner une difficulté pour exprimer, pour expliquer, c'est qui lui dire un peu plus tôt qui c'est-à-dire légumes peut faire l'acquisition peut acheter tous les jours. Et Xavier Duval, il montrait qu'il dans le rapport de l'audit, il y a un légume qui est disponible et qu'il peut dormir pendant plusieurs jours. Donc, c'est après lui, peut dans sa acquisition quotidienne qui supposé peut faire par l'hôpital. Et là, le ministre de la Santé dit même quelqu'un à domicile, une famille, est capable de c'est-à-dire produit, légumes dans ce frigidaire pendant longtemps et après 4-5 jours, les consommer. Mais il dépend dans quelles conditions ça va légumes-là, donc peut garder. Et ensuite, il rappelle qu'il y a un grand nombre d'employés, donc il y a environ 11 000 employés, 14 000 employés, hommes et femmes, qui peuvent répondre à l'appel, pour lui, à qui profite le crime. Pour lui, c'est la politisation. Mais Xavier Duval, malgré tout, il attire l'attention une situation qui concerne l'intérêt public, c'est-à-dire l'intérêt général, pour qu'il y ait beaucoup de redressement. Et le ministre reconnaît qu'il, quand même, à partir du rapport, à partir d'une question du leader de l'opposition, pour continuer donc veiller qu'il y ait une amélioration dans les conditions.
Oui, mais de manière générale, Jagdish, foodstuff qui finit expiré, finit gâté, il ne faudrait pas tarder pour débarrasser ça foodstuff là depuis le store. Parce qu'il est capable d'arriver par méthode. Mon père, c'est pas de séparer bien, mon père,
oui, dans quelles conditions,
mais pas capable qui pendant plusieurs jours, ça reste dans un store.
Oui, Xavier Duval, il mentionne
il y a un risque à la santé de ben patient. Donc, nous souhaitons qu'après ce qui finit de passer, prendre une action plus prompte. Et sinon, en début de séance, le député Eshan Juman du Parti travailliste a été expulsé suite à son interview dans l'Express dimanche. Il dit que le ministre Jagat Pal, qui joignent 3 hommes
religieux,
hommes religieux dans Committee Room, Et il n'est pas vrai, Jagdish.
Oui.
Il finit là dans la conférence au ministère des Finances.
Oui, nous pas connaître, nous avons vérifier si l'Express mentionne le committee room ou bien mentionne l'hôtel du gouvernement. Si ça concerne l'hôtel du gouvernement, alors c'est-à-dire le speaker il confirmé qui le ministre Jagatpal il joint les hommes religieux dans la salle de conférence du ministère des Finances qui trouve dans l'enceinte de l'hôtel du gouvernement. Et la speaker, il profite de l'occasion pour rappeler encore une fois que l'hôtel du gouvernement tombe sous son contrôle et qu'il y a 2 committee rooms, les 2 fermés, excepté sans sa permission, pas capable d'utiliser la salle là. Là, il y a une question concernant certaines nuances. Est-ce que l'Express mentionne committee room ou bien il mentionne l'hôtel du gouvernement? Si c'est l'hôtel du gouvernement, dans ce cas, il confirme qu'il finira une réunion entre le ministre de la Santé et 3 hommes religieux, comme a rapporté dans la presse. Donc, nous pas prononce-nous directement là, nous pouvons bien faire le suivi.
Oui, et ils vont préciser qu'il y a un rapport d'audit interne qu'ils avaient le Duval, fin mentionné là. Donc, c'est Ben Dimoun du ministère de la Santé même qui fait partie de sa comité là. Donc, il y a entre autres le secrétaire permanent qui préside sa comité là.
Le comité, oui.
Et puis, il y a tout le cadre du ministère qui siège là.
Oui, et il concerne 2 l'hôpital surtout, Dr Ditou, et l'hôpital Brown-Séquoia à Beaubassin. Et le ministre de la Santé mentionne également les médicaments qui, Dr Faradomir, il fait mention, il montre une photo, il reconnaît qu'il y a des médicaments qui périmés et qui périssent toujours dans le store.
Ouais.
Et c'est une question qui intéresse beaucoup de Mauriciens qui sont à l'étranger parce qu'ils peuvent suivre de près un peu pour guetter dans quelles conditions, surtout Maurice, et comme un ministre de la Santé peut dire, nous avons beaucoup d'awards, beaucoup de médailles concernant l'efficacité de nos services de la santé. Nous avons un exemple pour l'Afrique, nous avons un exemple même pour le monde, mais quand il y a une situation que le rapport interne relève ban manquement, ban faiblesse et surtout non-respect ban aspect alimentaire, non-respect ban aspect d'hygiène. Là, à ce moment, donc, c'est une question qui bouleverse l'opinion publique, qui crée une certaine, ne pas dire une irritation, mais quand même, qui crée beaucoup d'inquiétudes et beaucoup de concerns dans l'opinion publique.
Et le temps qu'il nous peut débrief la PNQ, Jagdish, nous finir une copie de ce rapport-là. Bien sûr, nous pourrons venir là dans le même bulletin d'information. Par exemple, on trouve un paragraphe que le rapport dit, le rapport d'audit interne, the committee took note that food served in ward were cold. At the time, gap between serving the food and collecting the food from the catering unit had a delay of 15 plus minutes. It was also noted that the food was served in a normal trolley rather than food trolleys, which were equipped with bin mirror. Plastic containers were also being used to serve food instead of stainless steel containers, increasing the risk of contamination. Donc, il est clair que le rapport peut dire qu'il y a une condition déplorable.
Oui.
Et là, ça veut dire avec raison, il pose la question qui action ce ministère.
Et c'est un rapport qui date de 3 mois.
De 3 mois.
C'est très récent, donc à partir de là, Xavier Duval peut penser que le ministre de la Santé ne peut prendre aucune action et que sa situation-là peut perdurer. Et donc, il y a pourtant qu'au moins, comme leader de l'opposition, il amène et il relève ban fait pour qu'au moins il y ait un suivi et une correction nécessaire en cas d'une anomalie.
Voilà, autant pour cette PNQ, nous pourrons venir là et bien sûr sur le rapport d'audit interne du ministère de la Santé dans nos prochaines éditions. Merci d'avoir suivi cette tranche. Et là, Jagdish, bien sûr, les travaux parlementaires peuvent continuer avec la Prime Minister's Question Time. À 13h, j'ai un rendez-vous avec Dushila Mansingh pour le journal complet de la mi-journée. Merci.